All right, guys, here we go again. Today's topic of discussion is spinal bifida. So without wasting my time, let's talk about spinal bifida, right? So spinal bifida is a birth defect where the spinal cord and the spine doesn't develop properly. This happens when the neural tube responsible for the formation of the brain and the spinal cord doesn't close properly during the early stages of pregnancy. Now, the exact cause of spinal bifida is unknown, but there are specific risk factors that can lead to spinal bifida. One is family history. Two is environmental factors involving folic acid deficiency, consumption of alcohol during pregnancy, smoking of tobacco during pregnancy, then exposure to radiation, then exposure to higher temperatures. Then also the consumption of certain drugs like anticonvulsants. Example is carbamazepine. Now, with spinal bifida, there are three known types of spinal bifida, namely occulta, meningocele, and myelomeningocele. So with occulta being the mildest form, then meningocele being the moderate form, then myelomeningocele being the severest form. So with occulta, there's no significant signs and symptoms that it comes with compared to meningocele and myelomeningocele. So with meningocele, there's a sac-like structure protruding from the spine at the back of the child, but it doesn't contain the spinal cord or any nerves, right? But with myelomeningocele being the severest form, there's this protrusion of this sac-like structure which contains nerves and the spinal cord, leading to significant disabilities. So with the signs and symptoms, the first one you see here is this sac-like structure protruding from the spine, containing fluids. Then we have weak or paralyzed limbs or legs. Then the third thing I can see here is loss of bowel or bladder control. Then also there's a possibility of learning or mobility challenges. Now, when it comes to the treatment of spinal bifida, surgery is the main treatment for spinal bifida, followed by physical therapy, occupational therapy, and also the use of assistive device for mobility. So this is what I've actually gathered on spinal bifida, and I decided to share with you guys. Anytime I come up with a different medical condition, I'll try to learn uh, the causes, the risk factors, and also how it is being treated. And I share with you. If there's anything you actually don't understand or like you're confused about, you can actually ask and like I'll brief you about it. I'll explain. I'll do my best to explain for everybody's understanding so that we'll know when we're dealing with a severe, a moderate, or like a mild form of any condition. I hope this helps.